what's contributing to the high cost of healthcare in the United States, and it's just like leading to significantly worse outcomes that can be solely blamed on insurance companies. Because like, my
I
guess
don't think
is,
this is the major problem with insurance,
sure,
by the way.
because my guess is you could run this exact same analysis on private clinics, on hospitals,
Sure.
on pharmaceuticals, and we could find that all up and down the ladder, every single part of this system, there have probably been bad actors. There have been people that have lost lawsuits. There have been people that have like questionable practices sometimes. Like, I'm sure we can find this in every single thing. That's like been but up and down the ladder, it's probably the thing. Yeah.
Right. And so like the kill shot for me is like what would push me over the edge is, oh, okay, all these whistleblowers are coming out and saying, look, we do this without just cause. We make up stuff.
Yeah, but this is like the weakest. This is like an industry that probably employs hundreds of thousands of people, and you're getting a whistleblower that's coming out and making the weakest claim ever with no evidence at all. That's just conjecture in their opinion. Some of it's been literally contradicted, and then it's like, what am I supposed to take from this?
Yeah, maybe not. I mean, first of all, I don't think that a majority of people would come out and be against this because, like I said, a lot of the more egregious stuff is immediately caught, right? So complete fraud, embezzlement, making up numbers, like that stuff's caught, that stuff's whistleblown. I think the smaller stuff, and you can get into the politics of like manufactured consent, but it's like the people that are already there in these systems, the people that work their way up and become CEOs, they see it as like, oh, this is fine. Like, this is just like, some people you got to deny, some people you don't. Like, in the similar way that you're justifying it now, I don't think you're justifying, yeah, it's good that all these people are dying. If it's happening, that's fine. Like, obviously, that's not what you're saying. It's, hey, like, this is how insurance works. You got to pick and choose who lives and dies sometimes. It's a zero-sum game. Like, that is how they view it. And when you're in this system, I don't necessarily think these people are looking at it like, oh my God, we're so awful. It's like, yep, this is how it works. This is the status quo. How can I do something about that? And then some people who are higher ups do come out and say, well, shit, I don't think this is the way it has to be.
Sure,
that's
but I'm just saying, yeah, but I don't, but that's, well, is that really your position though? Like, didn't you make a video on this? If I were to look at the video that you made on this, is it going to be that position or is it going to be?
Yes, yeah, it is. If you look at the video I made on it,
and they need to be held accountable.
No, it's not. I actually recommend everyone go watch that video because it's actually less of a strong claim that I made in the debate because my first big take is no, we should not be killing people in the streets. I think there's plenty of room for reform. There's so many things on the spectrum between that and what we're currently doing, which is probably not enough that we can do to push this in the right direction. And the people like Brian Thompson, even if he is committing heinous evil acts, I don't think he's necessarily even this like unreformable monster. I think he's part of that system. It's kind of explained as what is to be done in that system. And I don't even think he sees if this stuff is happening. If you grant that, he doesn't see the downstream effects of it. He sees it as numbers on a screen. And I think that if you kind of take him or some like Northrop Grumman CEO who makes bombs or any of these people and show, hey, this is the downstream effects of your actions. Do you think we should change them? I think that's there's a much better argument for that than these people are like Nazi Hitler McGee's and we should murder them in the street. So yeah, like that is my position in the video.
Wait, so what is our disagreement then? Or what do you think you and me have?
Okay, so this was the interesting part. We never got to this in debate. My disagreement, and I think you actually agreed with this, although with the caveat that you don't think the denials are happening on the same scale, is that let's say all this is... Sure. And that's fine. Let's say they are. Just for the second round, please just grant me that. I know like you aren't convinced, but if they are happening, if you are one of these people who is going to die in the next week or month or whatever, or is suffering or essentially has their money being stolen out of their pocket by an insurance company, and you see that there is no direct recourse from the legal system or the current anything that we live in system that is going to punish these people, what do you tell those people? Because I don't want to tell those people go out and kill people because I don't want to live in the world where that happens.
If that is the case, then I mean, like, I think you're basically most of the way there to justifying that, of course. But that's like
right.
That's
all I kind of wanted to have. But I do think there are other options, right? Like you I think you said this in the debate. You said tough shit, right? And it is kind of tough shit because I think what I have to tell them, and I guess what you're telling me
wait, hold on. If I said tough shit, I have to go back and look. But it's probably to like something that you might perceive to be as like unfair. But if I'm granting everything that you are paying money to an insurance company that says they're going to cover you for condition X, and then you come down with condition X, you go to the hospital says sorry, even though this might be life threatening, we're not going to treat it, and then your insurance company tells you fuck off, kick rocks, and then you try to sue them, and the courts are like, nope, we're protecting them because of lobbyists and blah blah blah. At that point, fuck it. I mean, if you're gonna go fucking postal, like knock yourself out. Like you're very. But
that's farther than I would go, right? Because what I'm saying is, I don't want to, like, would you agree that's probably, like, this killing is probably not going to change anything for the better? If anything, it might think
no, the difference is that, like, when you say, can you just assume this? I feel like you're at, like, 60% asking me to assume 30% more, and I'm at, like, 1%, and you're asking me to assume 98% more. That's the issue. I think you feel like in your mind that you were, like, basically at this point, we're over halfway there already, and in my mind, I'm like, we haven't even begun to establish this as fact.
Well, that's why I kind of wanted to say, like, clearly, the people that are coming out with these anecdotes, they think this regardless of whether or not they justifiably
Yeah,
think
but
it.
that's
So let's
but
say
I
they're
would say
wrong,
that, but
right?
this would be the equivalent of the example I used earlier. Like, okay, I want to ask you an honest question. Do you think that we should kill all black people in the United States? I'm guessing you would probably say no, and then I would say, okay, let's just assume for argument's sake that they are genetically predisposed with warrior genes to kill us, that they will never integrate into society, that ultimately their goal is to purge all white people in the United States, and that they've already begun taking concrete actions to kill all of us. At that point, do you think we should kill them all? Like, you almost kind of have to say yes, but it's like, Jesus, that's like,
Yeah, but it's like saying yes to that is insane. Yeah, no, I understand that. No, 100%. But what I'm trying to say here is, okay, like just addressing it in reality, like outside of the hypotheticals, if these people, like you see all these, it's not majority, but there's a large amount of support for this person. A lot of people are like, oh, good, he fucking got him. Yeah, good riddance. A lot of people are coming out with these stories, which may or may not be spurious, that are like, hey, like this is happening to me. My stuff's denied. My stuff's denied. Like, and what it seems to be, if your understanding is true, I know you're skeptical and you're more in like the agnostic area, but it's like, hey, this hasn't been proven to me yet. And again, I haven't proven it to you. So unfortunately, the point is, if they think that, what do we do about that? Like, do we tell them, hey,
well, the first
actually
part that
your
you,
suffering
like,
isn't
literally
real,
the first
or-
thing you do is like try to like get people back to a more factual based world, right? Like right now we're having the same conversation about H-1Bs. Is it true that Indians are invading this country en masse at the behest of capital owners who are using them as indentured servants to displace and depress like the white race, because Jews are ordering it? Like, how do you fight back against that? It sure as fuck isn't on the policy level. Like, that's on the information level. Like, I'm not going to say, okay, well, maybe to appease some of these people who think that Jews are controlling immigration, maybe we should immigrate a few less Indians. No, that would be insane. Much the same. I'm not going to say that, like, okay, well, we need to have these huge penalties for insurance companies or, sanctioning the murder of some CEOs because a whole bunch of people are misled by public information about what's actually happening, especially when it seems like the book written on this, like, mainly cites to like car insurance stuff or pre-ACA stuff, which I think are like substantially different environments or insurance markets. I would say like, okay, well, we should probably fight more on the insurance, or not on the insurance, we should fight more on the information level, because even if we came down as harsh as possible as we possibly could on insurance companies, it would change basically nothing about healthcare in the United States. And what's worse, it might change nothing, and people might feel better about it because they saw something happen, even though nothing happened, which I think would be bad.
When you say it wouldn't change anything, what wouldn't change anything? Yeah, I agree. We shouldn't be sanctioning CEO
Coming
killings, but,
down
like,
hard on like insurance companies, I don't think would change basically anything in the United States. It wouldn't fundamentally alter any of the engagement we have with healthcare. It wouldn't really do much of anything.
You don't think if, for example, we said it's mandated that you release your claims data like the Chubb does, that might make it a little more transparent?
I don't think Chubb is even remotely. Chubb is not remotely comparable here. I don't even think they do real health
throw
insurance.
them out
It seems
then.
like
Let's
they-
just say we say, hey, you guys have to release your claims data because we want to see whether or not you're unjustly denying people. Maybe they're not. What if we just said, hey, government mandated,
You could say
have to do
that, but at that point, my guess is every insurer would probably just abandon that market, and then it would just have to be the government doing it anyway, because you're already in such.
They'd all leave America?
No. They would abandon the Medicare Advantage market. They would just leave that market.
No, I'm trying literally every single health insurance, like every number, not just Medicare Advantage.
Oh, if all of it had to be published, then you would probably just destroy all those markets because nobody would be in the health insurance market anymore. You'd have no competitive edge or advantage because you're publishing literally every single thing proprietary that you've discovered. So everybody would just
No, not everything. Just your claims data. Just, hey, these are how much we pay out. This is
It
how
can't
much.
be
like,
just
you know,
your claims data. It has to be everything. Claims is everything. Right? You understand that the whole point, that's the whole insurance company's business, is figuring out how much do we pay to which people. That's the data that your entire market is based on, right?
No, maybe I'm confused, but I'm not saying like, hey, like, why do you make these decisions? I'm not saying what is your company policy. I'm saying go through these numbers and say, okay, we have this many clients. There are this many claims. We find this many to be fraudulent. There are this many payouts. This is the average payout for this kind of claim. Like, is that not something you can release, or why not?
No, not satisfactorily, because then you get people gaming those systems. So let's say you say I only have to release the amount that I pay out, but I don't have to release any other information. What if I get my actuaries to run the data and I find out, that like Chinese people and Native Americans have some of the most like higher like appeals rates or whatever, and we're just not going to sell insurance to those people, and all of a sudden now my claims data looks better than everybody else's, and I've got like the least appeals and the least denials ever, but it's because now I'm engaged in like bad business practice to try to bring those numbers artificially down because these are the only ones I was forced to release, and now that's what people are judging me on. Like a lot of people are sucking off Kaiser because they have low denial rates supposedly, but like Kaiser is one of the most like locked in network providers in the US. It's not even true that just because you have Kaiser you're gonna have a better experience. It just means you're gonna be super ultra locked into their in-network providers versus going out of network at all.
Right. They have got a big like kind of conglomerate industry. I had Kaiser at one point. I know exactly what you're talking about, where it's like, oh, we have the hospital, we have the psychiatrist, we have everything. So it's harder to deny because you don't go out of network. Yeah. Okay.
But I'm just saying that like all of this effort and all of this is like a waste. Like we should be looking to like expand Medicare or like try to fight for some kind of public option that might be like Medicare. Like if we got everything released about these health insurance companies in the perfect way possible, maybe we're saving like 2% or 3% when we go to the hospital, but like it's not helping much at all. Like it's
Yeah, and what's the claim that like 40,000 people die a year from this? Which let's assume that's true. I mean, that's the same as car accidents. That's the same as gun deaths. Like it's not that big of a number. Maybe the non-death issues and the stealing is a greater risk, but like I agree, it's literally not the biggest thing, and I do think it would be solved by expanding Medicare. I'm just kind of trying to speak to the point of why is everyone so fucking happy about this? And like I don't know if I agree with you, but like it does seem to be that this is a massive misinformation problem on your side. Yeah.
why do you think that most people think that UFOs were flying over New Jersey because there actually were
Do
aliens
most
up there?
people think that? I don't know. I'm not trying to appeal to the masses, right? Like,
Well, you literally
I'm
are
not saying-
appealing to the masses. Let's say I can show
Well,
you that-
I'm not, because I don't agree with them. I'm just saying, like,
Okay, let's say I can show you
think-
that 40% of people think that the election was stolen in 2020. Or let's say that I can show
Sure.
you that what percentage of Republicans believe in QAnon or hurricane machines or anything else. Like,
Yeah. Again, that's why I'm saying, like, it's not just, oh, well, a bunch of people think this. It's a question of why they think this. That's
well,
like
why
a
do
little
they
more
think it then?
important
Do you
to
think
me.
it's because of the actual practices, or do you think that?
That's my I mean, that's what I am understanding from this book. And like I said, it could be misleading. It could be bad.
Sure, but like, doesn't
based
it
on-
hurt that when we think we understand this from this book, that one, this is an old book. It sounds like it was just 15 years ago or 10 years ago it was written
it's
at
been old
least.
books.
Or I'm sorry, not 10, like 15 or 20 years ago. So one is
16
old-
years.
16 years. Okay, so one is that it's old. Two is that most of the examples cited are not from health insurance markets, and then it's pre-ACA, which dramatically changed the health insurance field. Like if these
That's
were
the one thing, actually, can you talk about the ACA dramatically changing? Because I think the 80-20 rule you brought up was the one thing that was like, yeah, that does make sense, as like this would be one of the things that might have prevented this stuff. But what
Well,
else in the ACA,
So I
other
think
than
that
the pre-existing condition?
So I think that
would
like
have done
claims
this?
were changed. Like I think that there's a response period for claims. Like it has to be within 12 months that you respond to a particular claim. The pre-existing conditions thing was a really big one. The market's changed a bit, and that people aged up 25 or 26, I think, were able to
Stay on their parents' insurance, yeah.
insurance, or yeah. So this is all like stuff that has probably changed these markets like pretty dramatically. Also things like when you talk about like a lot of the issues that we're having right now, like that whole 90% denials are all based around Medicare Advantage plans, which is like a bonus insurance you can get on top of Medicare just for old people. So this is a whole new
But
market
it
that didn't even
is
exist.
also a replacement, right?
I don't believe it is, no?
It's both a, hey, this can wrap around what your already Medicare Advantage or your Medicare basis is, but I believe you can use Part C as a replacement for A and B, and because of that, you look in the stipulations and the regulations for Part C, it has to cover everything
Yes,
comparably
Well,
that A and B does,
yeah.
right?
But what I'm saying is that like, yeah, that Medicare Advantage plan will never give you less than what Medicare gives you. That will never happen. It shouldn't.
Well, I mean, I think actually in the Senate report, it said that it did, and they need to correct it. Like they're like, hey, you need to look into this because you're supposed to do this and you're not.
Hold on,
which
wait,
would
wait,
be
wait,
an
wait.
example
Which
of
part of
the
that?
regulation working. Again, this is just me trying to remember. Let's see if it's less. I don't. Fuck. No, hold on. It might not be in the report. It might be in the stat investigation. Sorry, but let me double check this. Medicare Advantage. Okay, yeah, at the very end, the last page. This is particular. Oh, here, let me just read the whole thing. Although the subcommittee's recommendation in this report are targeted at regulators, this should not distract from the fact that it is insurers who are using prior authorization to protect billions in profits while forcing vulnerable patients into impossible choices. This is particularly troubling when recent analyses indicate that Medicare Advantage is more expensive than traditional Medicare, with one assessment concluding that, in 2024, the government spent 22% more to fund Medicare Advantage plans than it would have had those beneficiaries been enrolled in traditional Medicare. There is a role for the free market to improve the delivery of health. Okay, blah blah blah. This is just their opinion, but
Wait.
it just
So wait,
says
wait. So
insure-
what did that just say? What are we even talking about here?
I was saying that even though it's supposed to be the same, it would appear in recent analyses that they're actually spending more on traditional Medicare. Like it's costing patients more.
But
than otherwise would
what
have.
is it? What is it saying here? It should not distract from the fact that insurers are using prior authorization to protect billions of profits while forcing vulnerable patients into impossible choices. What does that mean? What does this have to do with traditional Medicare and it like not covering things that traditional Medicare covers? It doesn't sound like that's.
I don't think those are necessarily two related sentences because this is a summary of the fact that they're using the AI system to replace administrative costs. It's saving them billions of dollars thanks to denials. And also, it's particularly troubling because, adjacent thing, Medicare Advantage is currently seen as more expensive than traditional Medicare. So that's how they're related. I don't think it's like, hey, by the way, this is also bad because of, and then third thing that is not completely related to the first sentence.
Sure. But I don't see what is like. The original claim had to do with whether or not, like, if you were enrolled in this plan, that you're getting like less than your Medicare thing. But that's not the case, right? These are usually like bonus plans, right? Or I think there's almost always bonus plans. So you're not paying for this and getting less than what you would ordinarily be covered by Medicare anyway, right? Like, there's an additional.
Well, this seems like you're paying more and also sometimes not getting it because of this specific.
Where are you saying?
plan
Wait. Where are you ever seeing not getting it in this last paragraph or any part of this? You're not getting it. It sounds like
the denials.
did the denials have to? Denials happen under Medicare ordinarily.
Yeah, but the claim in the Senate report is that they're happening at a massively larger scale than they should be.
Yeah,
or
but if
at
it's
least
for bonus
that's what they say. It
insurance,
seems
yes,
to be
but
happening.
But if it's for bonus insurance, that means it's also trying to cover things that Medicare ordinarily wouldn't cover. Even if the denial rate was 100%, which would be extreme, but even if it was 100%, that doesn't necessarily mean that they're covering or that you're missing things that you would have gotten under Medicare, right?
Right, and this is where I'd have to break down, okay, what part of the Medicare Advantage is supposed to be the supplement to Medicare A and B, and which part of it is supposed to be the equivalent of Medicare A and B, I don't know the breakdown of that off the top of my head. I mean, or at all.
Sure, but I feel like if it was the case that there were things that you were entitled to under ordinary Medicare, which you don't have to pay for at all, or I'm sorry, at the very least you don't pay much. I don't know, there might be copays or something, but if you've already paid your taxes into Medicare, if there were things that you had a Medicare Advantage plan and now you're not even getting covered for stuff that Medicare covered, I feel like that would be like a headline for this report. It wouldn't be buried into like a random paragraph here, right? That would be like one of the biggest things that is like, if you didn't have this Medicare Advantage plan, you would already be getting this for Medicare, now you're getting fucked over. But I don't think that is the case at all, no? This is just for bonus plans, right?
Wait, I'm actually confused. It sounds like it is what you're saying. So this plan, like when these people get denied some sort of post-acute care, they can't just immediately jump onto Medicare and get the replacement, right?
But I don't know if they would have ever even been approved for that under Medicare.
Okay, but like, then what does that say? Because if some of these people need this, right? Like,
No,
I guess that was
well,
established.
no, we've said that it would be nice, but I don't, like, need it. I don't think that's ever been
I
established.
thought the stat cases that show, hey, this person, like, oh, okay, well, hold on. There was the one that you said was medical malpractice for sure, but like,
well,
what
hold on, I don't
about
want to
the
claim
ones...
medical malpractice. I'm saying the story is suspect that a guy got discharged from a
Right.
acute
It could
care
be. I'm
place
saying
and then he
like,
had
that
meningitis
doesn't
the
prove
next
anything.
day. That
I'm
sounds
agreeing.
insane.
I'm agreeing.
Sure.
Yeah, gotcha. And what I'm saying is the other one where there's the claims from the employees that are saying, hey, like it appears that the people we are denying are going to die within weeks or months because they're not getting the care, the daily care, the injections, whatever that they need. That is the claim made by the stat investigation, or at least that
If
they
this
reported.
was the case, this would show up somewhere than just an anonymous testimony and an anonymous thing. There would be like mass people dying as a result of infection or something after
But that's the thing. It doesn't have to be mass, right? Like this isn't that many people. This is a small sliver of a smaller sliver of the insurance.
If it's a small sliver of a small
company.
sliver, then that shows far more that it was either due to some employee negligence or something than a rule. How have we crafted a rule to make billions in profit that's only covering a small amount of people that's undetectable in any larger
testing
statistical
out
survey?
their rollout of this system, right?
I
Maybe
would
they
need
would
to
have
see
applied this
evidence
on a
for
greater
any
thing
of this. I
after.
feel like this is an extraordinary.
Well, this is in the Senate. I know this is in the Senate, but they're testing the rollout of this AI system on the Medicare
Yeah, but
Advantage
you're
plan.
saying
That is in this article.
No. That's not what your claim is. Though. Your claim is that they're testing the rollout of a system that is meant to specifically deny coverage to a sliver of people who would be entitled to it otherwise under Medicare. I don't think that's the case at all.
What would I need to show you in this report that establishes that?
Literally anything at all, ever. Anything. Does this
Right,
report
right.
even
But like,
claim that?
let's say, well, the report is claiming that they're overly denying people. It is harmful and is with intention. I don't know what specific.
Well, they said that it suggests that. I don't even think they make that claim, which is why most of the recommendation, or every recommendation, I think, was just to like regulators, basically.
Does this? And I'm not claiming you're being bad faith because you're not, but like, it feels like this is setting up the dominoes, at least in this Senate report. Like, look, this seems like what's happening. You can look and there's like internal documents where they are very aware that this is saving them money, way more money.
No.
From...
You keep over assuming the strength of your evidence. You haven't shown that anywhere ever. You haven't shown any
Okay,
internal
yeah, sure.
documents. You've only
I have the graph. Yes, let me show you.
Wait. I'm just saying the fact that you keep saying these things casually means that you think you have proven it, and that's why you keep uttering these things. But to me, if anything, I'm just getting more and more evidence in favor of the other direction. I never saw those McKinsey documents at all. It sounds like those McKinsey documents were just being paraphrased by the author of that book, and all of the examples are from like car insurance markets and everything else. So it sounds like the evidence is way weaker even than I initially thought it was. But then you just like, you'll casually say, because I understand why you think I'm asking for an ungodly amount of evidence if you feel like you've already shown that there are internal documents that have leaked that have proven that they're acting in bad faith.
Yeah, I agree. Let me grant you this. I don't know if you've ever taken like a college course, but like professors who are really bad at explaining things, it's not because they're not smart. It's because I don't even want it. This sounds pretentious as fuck because I'm not trying to compare myself to a fucking professor. But like once you like read a bunch of this shit and like you forget how much of it is like, oh, that's just a given, and how much of it is like, oh, I really need to establish this. So I read this thing like a bajillion times, not all the way through, but like to me, it's like, oh, duh, this part. And that's why it was so frustrating in the conversation, because it was like, oh, like I didn't know that I would have to establish the denials are happening. I thought that was just a given, but clearly
Well, yeah,
it's
but
not.
you
So
wouldn't have to
give me a
establish
second.
it, but the book would have to establish it. But it seems like the book doesn't even do a great job at
Okay,
establishing
and it's not
it.
satisfactory. I think the specific.
Well, wait, no, not that it's not
is-
satisfactory. It's that it doesn't even seem to try to establish these things. It gives you some quotes from people that are working in like other unrelated insurance markets, and then it's trying to set like a pattern.
Hold on. Unrelated. All I tried to establish before we even get to any healthcare stuff is, hey, insurance companies sometimes unjustly deny you. And so if these quotes from these people are true, they are claiming it happens. They're like, this is practice. This is common.
Well, yeah, but this
in
is such a
industry,
soft
right?
claim. We would never argue this ever. Like I would always agree. Like you could give me literally any industry, government or private, and I would agree that they
But it's
probably try
widespread
to.
though. But
Well,
the
no,
quotes
no,
are
no,
saying,
no,
like,
no.
this
That's
is
not what you
industry
just.
practice.
Hold on, that's not what you just said.
Okay, but that's what I'm trying to say. I'm saying the quotes from the people that are saying, "Hey, this is industry practice," or "Hey, like
Oh,
we're
industry
all doing this." Like,
practice? Yeah, I wouldn't agree with
Yeah.
that necessarily. No, but I don't think we've
right.
even
So
come
like they could
close
be
to
lying, but
establishing
what
that.
I'm saying is like
Well,
I'm
no,
just
no, no, wait,
assuming
no,
they're-
no. You just said they could be lying. Even the quotes themselves, those people don't allege that. Just the author of the book does, based on the quotes. Not like that affidavit that we read earlier. Nobody is making that claim in any affidavit or in any signed testimony or any sworn or anything else. Doesn't seem
What
like
about
any of that's made ever.
the like reference 127 that we were in the book where she says this playing hardball on the missed claims like seems to be industry practice. You kind of said maybe that should be the case, but it is definitely like, hey, we're trying to discourage anyone from pursuing
Hold
any
on,
of
wait,
these.
wait. On what was the page that footnote was made? You said footnote
Let's see.
127.
Is it footnote 127? I don't know if my autism's working right now. Let me see.
Hold on, I can find it. I'm close.
128. Excuse me. This is from Grace Hess. Like this one again. Page 119.
128, page 119. The company was going.
Paragraph
But
starts with
this has to do with the
Allstate
missed.
has
This has to do with one is auto
Alright,
insurance, which is
so-
okay, but this has to do with the missed claims. This is a very, very,
right.
very
So
specific
what-
thing of things I
and what
know.
I'm-
Yeah,
Go ahead.
this is not like this is nothing. This doesn't get me anywhere in anything. Like even if everything she was saying was true, this doesn't get us anywhere in this other. Like it moves me literally 0.0% in any direction. These
So,
have to do
like-
with like soft tissue injuries that are unprovable on a scan or anything else, and they're just saying that like the companies are going to be like a lot more hardball against these things. And based on a review that I just read, and there may be more information out there, I don't even know if these are like real injuries. They literally definitionally seem
Sure,
to be
but
things.
the
that-
idea of forcing arbitration because they want to send a message, does that not seem at least a little bit like not sit well with you at all?
I don't know. It depends on if they feel like the majority of these things are fraudulent claims or not. Like
Even if they
courts,
are.
then no. Then I think it's probably then fuck them.
Okay, sure. So then let's say if this is your position, I'm not trying to frame this as bad. Do you think then, because let's say made up number, 3% of them are valid, 90% of them are false, they should play hardball on every single one, fuck the people that have valid ones because too many people are ruining it for those people. And then we kind of shift the blame over to the fraudulent claims because they're ruining it for
If
everyone.
there's a type
by-
of claim where 97% are false, yeah, I would imagine that the insurance company would just stop offering coverage of that completely.
Okay. All right. If that's the case, I don't know. I'm sure it's not 97%, but it could be a very high amount. I'm just trying to establish, like, when I read stuff like that, again, it could be the book framing it weird, but like, it seems to me like this seems like let's try to save money on this. But
Yeah, they are probably trying to save money on it, but it's because it's like a pseudo medical claim. It seems like it's not even a real thing.
well, it's a real thing. It's just also very hard to prove, and there's lots of fraud with it, right?
Sure. So it seems like if you wanted them to do that on anything, I would want them to do that. I would, as a customer of an insurance company, I would want them to play hardball on that. I don't want to play more premiums for people who claim 12 months after a like non-identifiable car accident, they have whiplash. I don't want to pay an extra $20 a month on my insurance to cover for people like that. I wouldn't want to buy into an insurance company like that. Fuck that.
You cut out for you guys too. I can't hear him.
Wait, can you hear me? Hello, hello?
Oh, you're back.
Yeah, I wouldn't want to be, if I knew a car insurance company was offering that shit, I imagine the premiums would be way more expensive. I wouldn't want to buy into that car insurance company. I would just never say
Yeah,
that. I'm gonna
especially if they weren't properly investigated fraud. I would agree. That's what I'm saying. Is like this could be, like you said, if everything you're assuming is true, like that's not something that's outside of the realm of my imagining a possibility. But all this stuff combined, all the whistleblower stuff, like this does point more to me that like, hey, this seems like they're being malicious about it. All these anecdotes come up. Yeah, they're anecdotes, but it's like I find it very hard to believe that every single one of these people are being properly denied coverage and also just did not know that they could do X, Y, or Z to fix their situation. That just seems kind of ridiculous to me. But like, it could
Sure.
be. I'm not saying
this
it's wrong.
this would be what I would say. I would read 5 paragraphs of this. This is just how I feel about this entire thing. Okay, I feel this way about a lot of things.
Which
okay?
part? Where? Sorry.
It's not anything you've linked to me. Okay.
Okay.
Okay. It
That's
takes a
better.
special sort of person to be a cardiologist. This is not always a good thing. Okay. You may have read about one or another of the quote cardiologists caught falsifying test results and performing dangerous, unnecessary surgeries to make more money end quote stories, but you might not have realized just how common it really is. And then link to Maryland cardiologist performs over 500 dangerous, unnecessary surgeries to make money. Another link to unrelated Maryland cardiologist performs another 25 in a separate incident. Another link to California cardiologist does quote several hundred end quote dangerous, unnecessary surgeries and gets raided by the FBI. Another link to Philadelphia cardiologist cardiologist, same thing. Another link to North Carolina cardiologist, same. 11 Kentucky cardiologists, same. There's another link. Actually, just a couple of miles from my own hospital, quote, or a link to another thing, a Michigan cardiologist was found to have done $4 million worth of the same, et cetera, et cetera, et cetera. My point is not just the number of cardiologists who perform dangerous, unnecessary surgeries for a quick buck. It's not even just about and then another link to cardiologist insurance fraud, another link to cardiologist kickback schemes, or another link to cardiology research data falsification conspiracies. That could all just be attributed to some distorted incentives in cardiology as a field. My point is that it takes a special sort of person to be a cardiologist. Consider the sexual harassment. And then another link to head of Yale cardiology department fired for sexual harassment with, quote, rampant bullying, end quote. And then another link to Stanford cardiologist charged with sexually harassing students. And another link to Baltimore cardiologist found guilty of sexual harassment. And then another link to LA cardiologist fined $200,000 for groping medical technician. And then another link to 3 different Pennsylvania cardiologists sexually harassing the same woman. Another link to Arizona cardiologist suspended for 19 different counts of sexual abuse. And then another link to world's leading cardiologist fired for sending pictures of his genitals to a female friend. Another link to New York cardiologist in trouble for refusing to pay his $135,000 bill at a strip club. Another link to Manhattan cardiologist taking naked pictures of patients, then using them to sexually abuse employees. Another link to New York cardiologist secretly installed spy cam in office bathrooms just to shake things up. Another link to a Florida cardiologist was falsely accused of sexual harassment as part of a feud with another cardiologist. And yeah, you can argue.
I don't know where you got my resume, but like, this is not cool that you're doxing me on stream.
Okay. And yeah, you can argue that if you put high status men in an office with a lot of subordinates, sexual harassment will be depressingly common just as a result of the environment. But there's also another link to Texas cardiologist who pled guilty to child molestation. And then another link to California cardiologist who killed a 2-year-old kid. And then another link to the author of one of the world's top cardiology textbooks was arrested on charges that Wikipedia describes only as, quote, related to child pornography and cocaine, end quote. Then it gets weird. Did you hear about the Australian cardiologist who is fighting against extradition to Uganda, where he's accused of terrorism, aggravated robbery, and murdering 7 people? What about the Long Island cardiologist who hired a hitman to kill a rival cardiologist and who was also, for some reason, looking for enough explosives to blow up a building? Like I said, it takes a special sort of person. You can, if you look at any sufficiently big industry, and cardiology is going to be a lot smaller in healthcare, you can get like a collection of 100 different anecdotes or stories or data points to try to prove a particular thing, but it doesn't, I need something. I don't even want to say like the smoking gun of like an insurer saying all of us in the insurance industry have widespread horrible practice. But when it's like 3 testimonies from a collection of markets of like across car insurance and everything else, where they say like we think that bad practices happen sometimes, like that's not even, you've moved the needle like 0.0001%. We're not even close to a subject. And the idea that like you can present like 5 stories.
If I moved you even a little bit to the left, if it's 0.01%,